Good afternoon, everybody. We're going to get started in just a minute or so, letting folks trickle in. Okay, good afternoon, everybody. My name is Tyler Brennan. I'm a health program specialist with the Managed Care Quality and Monitoring Division here at DHCS. Very happy to be here with you all today. And thank you very much for joining today's webinar titled Community Supports. Community Supports, Addressing Members' Health-Related Social Needs, including some key updates that we're happy to share with you today. So before we get started, I'm going to cover some general housekeeping announcements. We will have 90 minutes for today's webinar. At the end, we will provide a few minutes for questions and answers. Given how many people we are having join us today, the format that we're going to be using to approach the Q&A will be as follows. Throughout the webinar, if you have a question, please go ahead and click on the Q&A button at the top of the screen and add your question there. Our team will be monitoring the Q&A throughout the session. At the very end, our speakers will step through some of the questions that we receive. Please note there will not be an opportunity today for attendees to come off of camera or off of mute. To that end, we kindly request that you do not use the raise your hand feature. This feature appears at the top of the team's webinar screen and unfortunately has not been disabled, only because we're not actually able to disable that. So really, we appreciate your cooperation on this. Lastly, we are recording today's presentation. The recording and a copy of the slides will be available in the coming weeks on our DHCS website. With that, I'd like to turn it over to our first speaker, Deputy Director of Healthcare Delivery Systems, Susan Phillip. Susan?
Great. Thanks so much, Tyler. Welcome, everyone, and thank you for joining today's all-comer webinar. I'm Susan Phillip, Deputy Director for Healthcare Delivery Systems, and I'm just really thrilled to be here to open up today's webinar. This is the second of 2 DHCS webinars on key updates to community supports. Many of you in the audience are key partners in the delivery of these services to our members, and we're so grateful for your partnership and really excited for the growth of these services across California for our Medi-Cal members. So today's webinar will focus on recent updates to a subset of community supports services that were released just a few weeks ago in April. These are in Volume 1 of the Community Supports Policy Guide. We can go to the next slide. Okay, so just briefly, today's presenters, we will, as Tyler said, we'll field questions later on today, and I'll be joined by Michael Guizar, who's our Chief of Managed Care Program and Oversight Branch in our Managed Care Quality and Monitoring Division. We can move to the next slide. So many of you joined us a couple of days ago on Wednesday for the webinar on housing community supports. But for those of you who did not, just want to share by way of background, community supports are services that address members' health-related social needs, help them live healthier lives, and avoid healthier, costlier level of care. These important services are in their 4th year of implementation under CalAIM. And really, they are the cornerstone of our Medi-Cal transformation, which seeks to create a more coordinated, person-centered, and equitable healthcare system for all Californians. Since launching in 2022, nearly 300,000 unique members have utilized community supports, to improve their lives and address their health-related social needs. With more than 8 community supports available in every county, managed care plans and a growing network of community support providers have really made substantial investments and achieved amazing progress in delivering these services. A few weeks ago, as I mentioned, the department released an updated community supports policy guide, which really reflects over 18 months of extensive work to refine the existing service definitions and criteria. We've been working extensively with our managed care plans, our community-based providers who are delivering these services on a day-to-day basis, and our other important stakeholders to refine and improve the new policy guidance that are reflected in this latest release. We're really drawn on the deep expertise and longstanding expertise really on the ground experience from these initial years of implementing community supports. And again, we deeply appreciate the feedback and insights that many of you shared. So today's community supports webinar is focused on volume 1 of the community supports policy guide. So DHCS has reorganized the community supports policy guide into 2 separate volumes. And the volume 1 covers key services related to, that address members' health-related social needs, such as medically tailored meals, medically supported foods, asthma remediation, and supports for members to maintain residency in community and avoid nursing facility stays. Before we dive into these updates, I wanted to really briefly address how community supports fits within the broader Medicaid context. First, I want to underscore DHCS's commitment to these efforts and services. The department's vision and focus for community supports will continue under DHCS's active, approved waivers and managed care contracts through the Centers for Medicare and Medicaid Services. I want to state that these waivers remain approved in full effect, fully operational, and unimpacted by recent rescissions on health-related social needs guidance, given that CMS has indicated that states with approvals maintain those approvals. DHCS is really strongly committed to preserving California's existing array of services, and we will continue to monitor and respond to any future actions impacting the state's authority to deliver community supports. We will also use remedies available to sustain and defend our existing federal approvals against actions to disrupt implementation, and we are developing a comprehensive analysis and plan to do so. Okay, let's move to slide 4. Okay, so jumping into the guides themselves, as I mentioned, when we first launched community supports in 2022, we really had one policy guide that included all the service definitions for community supports, and we really now divided up into 2 separate guides. And this is really to accommodate new policies related to transitional rent and updates related to services that address individuals experiencing homelessness. So that is now included all in volume 2, which we reviewed back on Wednesday. And then the other remaining community supports are addressed in volume 1. We can go to the next slide. And since the launch of community supports back in 2022, as I mentioned, we really have engaged many of you as part of the feedback for early implementation and have identified opportunities to improve utilization. And this is really in alignment with a lot of feedback and our improvement loop that we have implemented since the launch of ECM, Enhanced Care Management, and Community Supports, and is reflected in our action plan. So we have made refinements and clarifications to many of the community supports definitions, really in an effort to streamline and clarify eligibility criteria and clarify service components. And today we're going to be providing an overview made to 5 of 8 community supports that are in volume 1. And we really recommend referring to the full policy guide for the details. Okay, go to the next slide. Okay, so we have a packed agenda. I provided a bit of update on community supports implementation. I'll go in a little bit more detail on providing some overview on how we're doing on community supports implementation statewide. Then we're really going to get into the meat of the policy guide updates of the 5 of the 8 community supports in volume 1, as I mentioned. And before I do that, I will provide a brief overview of closed loop referrals, which was a policy that was released back in December. So we'll provide a little bit of update on that. And then for any remaining time, we will use for Q&A. And as Tyler mentioned at the beginning, we'll be using the Q&A function to address questions. Okay, we can go to the next slide. Okay, we can skip this slide since we covered this. Okay, so we can go to the next slide as well. So I wanted to provide a brief overview of how we're doing on implementing community supports. So as I mentioned, the department's vision for and focus on community supports will continue under DHCS's active approved waivers through CMS and our contracts with our managed care plan partners. DHCS now has 15 community supports, including the mandatory community supports for transitional rent. And all of these will continue as critical services for our Medi-Cal members. In the last year alone, over 239,000 members used community supports to improve their health and well-being and reside safely in the community. And as I mentioned, more than 8 community supports are available in every county across the state. And managed care plans and their community support provider network have really made substantial investments to deliver these critical services. DHCS has supported managed care plans and provider capacity and infrastructure over the past several years to implement and expand community supports through the PATH initiative, as well as our incentive payment program. And these are substantial investments in building capacity and infrastructure. And the department is really committed to preserving the progress made by plans and providers, especially our community-based organizations throughout the state, to really offer community supports to our Medi-Cal members. We really recognize that there is an immense amount of work and effort of our implementation partners to build a workforce, to deploy new technology, to facilitate training and education, among several other activities that's really necessary to have these services come online and make sure that they are available and accessible to our members. We can move to the next slide. So as offerings for community supports have expanded across California, and so has our member utilization of these services. So this chart really highlights the total members using community supports by quarter since the launch in 2022. Just to let you know, DHCS does provide these quarterly data through our enhanced care management and community supports quarterly implementation reports that are available on our website. And we really encourage you all and all our partners to review the data that's available by county and by managed care plans for trends and community supports utilization in your communities. We can move to the next slide. Okay, so this just provides a little snapshot of utilization by service. So in the last quarter, medically tailored meals and medically supported foods was the most utilized community supports across the state. Members are also frequently using the housing trio and additional housing-related community supports, such as recuperative care. Today, we are also discussing clarifications made to service definitions of 2 of the least utilized community supports, which are the assisted living facility transitions and community or home transition community supports. So we want to talk about that today because we really do want to increase utilization of both of these community supports. We can move to the next slide. Okay, so I do want to share that we, as a department, monitor the network of community support providers that managed care plans contract with across the state. So this chart shows the growth of the total number of provider contracts for community supports by quarter. And in the last quarter, managed care plans held over 4,000 unique provider contracts for the delivery of community supports. So this really shows that there's an increase of providers that are available to provide these services statewide. We can move to the next slide. Okay, and we can move to the next slide. So I'm going to switch gears a little bit and talk about closed loop referrals and definitions and goals. So in addition to providing an overview of the community supports implementation, we really wanted to highlight new requirements on managed care plans for supporting referrals made for community supports. Right? Ultimately, we want to make sure that if a member is identified for a community support service and a referral is being made, that they are in fact getting those services as authorized and as they are eligible. So DHCS released a closed loop referral requirements for members in December of 2024, so just last year. And the goals of these requirements is to increase the share of members that are successfully connected to the services that they need. So while these supporting referrals have always been a key responsibility of our managed care plans, the closed loop referral requirements really enhance our managed care plan partners' efforts to track, support, monitor referrals made to a specific set of DHCS requirements. The closed loop referral requirements go into effect, we can go to the next slide, go into effect July 1, 2025. And again, the goal is that referrals made for community support services by providers, by community-based organizations, by members and their caregivers. The goal is that these referrals are tracked in alignment with the closed loop referral requirements. I will just mention that for sobering centers, that referral is not subject to closed loop referral requirements because often members receiving these services, they're getting them in real time without an extended referral process. So that's one caveat I would mention. So in addition to applying to community supports, the closed loop referral requirements also apply to all referrals that managed care plans receive for enhanced care management. So the department, we selected both of these service areas, enhanced care management and community supports, because they are really critical for high need members, right? Members that need both clinical and social services. So we really focused on those, and also managed care plans are also informed of all referrals for ECM and community supports because they have a role in authorizing the service and assigning members to the network of providers. So plans have visibility into the referrals that they receive. We can go to the next slide. The closed referral requirements are placed on the managed care plans, but members, providers, and referral partners can also expect to see some changes starting in July. First, we would expect members to receive written notice from their managed care plans when the community support is authorized or approved, and really have a support on re-referrals if our provider is unable to serve their needs. Community support providers will be asked to submit 3 new data elements in their monthly files that they exchange with managed care plans to help the managed care plans track and better support referrals made to community support services and identify challenges in referrals. And then there will also be changes for referring entities. So for example, referral entities or practitioners such as community-based organizations, primary care providers, social workers, those entities or practitioners will begin receiving notice from the managed care plans when the member's service is authorized and when the referral loop to the community support service is closed. So ultimately, the goal is to drive improvements in care coordination and care delivery for members seeking these critical services. So we really encourage those of you who are looking for more information on closed loop referrals to review the DHCS implementation guidance. And there's also a recording of a webinar specifically on this policy held back in February, and you can find this on our website. Okay, we can move to the next slide. Okay, so we're going to walk through specific updates to 5 community support service definitions that will go into effect July 1, 2025. We can move to the next slide. First, to share a quick recap, last September, actually, DHCS released proposed service definition refinements for 7 of 14 community support definitions. That was including then the housing trio and 2 community supports pertaining to community and assisted living facility transitions, medically tailored meals, and asthma remediation. Then in February of this year, DHCS released updated service definitions for 4 community supports, including the assisted living facility transitions, community or home transition services, asthma remediation, medically tailored meals, medically supported foods. So those were released in February of 2025. And then this update that we just mentioned also includes refinements to personal care and homemaker service definitions. So these new service definitions will be effective July 1, 2025. The one note would be that asthma remediation will have a longer ramp up given needed alignments with Medi-Cal covered benefits, which Michael will describe in detail shortly. Okay, so before I can move to the next slide. Before I hand it over to Michael, I wanted to again acknowledge the extensive contribution, research, input, just from many of the stakeholders to update this guide. These community supports were really selected based on strong evidence to address health-related social needs and reduce costlier services. And the field for these services and the research and the experience is really evolving. So we're really appreciative of the work being done locally to evaluate, assess, and continuously improve the effectiveness of these services. So with that, I'm going to turn it over to Michael to walk us through medically tailored meals, medically supportive foods, and asthma remediation.
Thank you, Susan. Good morning, everyone. We can go to the next slide, please. So just jumping right in, what are medically tailored meals and medically supportive food services? As Susan mentioned, these services are the most widely utilized community support by members. This particular support aims to improve health outcomes by providing food packages that are tailored to a member's chronic or specific chronic or serious condition. The medically tailored meals and medically supported food service is the overall name for a subset of services that members can receive based on their needs, including medically tailored meals, medically tailored or medically supported groceries, healthy food vouchers, produce prescriptions, food pharmacies, and nutrition education. Like all community supports, eligible members can receive these services through a referral to their Medi-Cal managed care plan. And one important note to highlight is that the intent of the medically tailored meals and medically supportive food service is to improve health outcomes and address chronic health conditions. It's not solely used to address food insecurity for our Medi-Cal members. Next slide, please. So for the service updates, we at DHCS did make clarifications to the existing service definition as the nation continues to refine and strengthen its delivery of medically tailored meals and medically supportive food through Medicaid. Providers, managed care plans, and referral partners specifically provided feedback to the department, to DHCS, that refinements were needed to clarify the eligibility criteria and each of the services that could be covered. So for example, details on what a food pharmacy service entails, and to standardize how managed care plans oversee the provision and quality of foods delivered through the service. Next slide, please. So in terms of the streamlined eligibility criteria that was undertaken, the first revision made is to further standardize eligibility criteria for this service. Effective July 1, 2025, eligibility has been streamlined to focus on members who have a chronic or serious health condition that's nutrition sensitive. As you can see in the box here on this slide, we have also at DHCS expanded the list of nutrition sensitive conditions for eligibility, and that includes such as, but not limited to provide flexibility to managed care plans to identify additional conditions for which medically tailored meals and medically supportive foods can have an impact on health outcomes. Next slide, please. So in terms of the specific service specifications here, we do want to highlight that there were clear expectations for medically tailored and medically supportive services including the role of registered dietitian nutritionists or other appropriate clinicians in the design and delivery of services. The medically tailored meals and medically supportive food service packages can be designed at the service level for the identified target chronic or serious health condition. Also wanting to note that medically supportive services are intended to be supplemental to the member's diet, whereas medically tailored interventions must be provided in specified quantities to constitute the majority of the member's food. So just wanting to also, include that more detailed descriptions of the design and delivery of each medically tailored and medically supportive service was included in the updated service definitions, and that also that the services must not be ultra processed, nor foods with excessive sugar or salt. And finally, the medically tailored meals and medically supportive services must also consider the member's cultural preferences or needs and food preparation and storage capabilities when determining the appropriate intervention for the member. Next slide, please. So with medically tailored meals and medically supportive services, also the service definitions updates include in our guidance more clearly defined or outlined that each of the 6 services under the service broadly were refined. So as seen here, 2 services are available under the medically tailored category, while 4 are available for managed care plans to offer under the medically supportive category, specifically medically supportive groceries, food pharmacy, produce prescriptions, and healthy food vouchers. We also at DHCS provided clarification that managed care plans are encouraged to pair nutrition education services with the medically tailored meals and medically supportive food offerings, but managed care plans cannot offer nutrition education as a standalone service itself. Next slide, please. So, what defines a medically tailored meal? So that can include, requirements for an individual nutrition assessment conducted or overseen by an RDN. It informs the development of a personalized nutritional plan tailored to the member's specific needs, and connection to the appropriate medically tailored service package. Also, the meal or the food package must meet nutritional benchmarks and provided at least 2/3 of an average individual's daily nutrient and energy needs, but also just noting that the service may also only cover up to 2 meals or equivalent of food per day. And finally, the design of each of the medically tailored meals or groceries a service must be tailored by an RDN or other appropriate clinician to ensure that the food provided adheres to established evidence-based nutrition guidelines to prevent, manage, or reverse the target nutrition sensitive health condition. Next slide. So on the other side, so what sort of constitutes medically supportive food services? That includes are provided that there's access to pre-selected whole foods that adhere to national nutrition guidelines to prevent, manage, or reverse nutrition sensitive conditions for our referred members. Unlike medically tailored services, the medically supportive foods are intended to supplement rather than make up a set portion of the member's diet. Also, the food package must be designed according to evidence-based guidelines and overseen or signed off by a registered dietitian, nutritionist, or another appropriate clinician. And finally, packages do not need to be individually customized for each member, but must be appropriate for the targeted nutrition-sensitive health condition or conditions. Next slide, please. So under nutrition education, we at DHCS also provided additional details on offerings of nutrition education that includes highlights such as nutrition education must be paired with medically tailored meals and medically supportive foods and cannot be offered as a standalone service, as mentioned. Nutrition education must also adhere to nationally established evidence-based nutrition guidelines. We at DHCS also encourage our managed care plans to consider if some members receiving medically tailored meals or medically supportive foods may benefit from other Medi-Cal nutrition education offerings, such as the medical nutrition therapy and diabetes self-management education. Next slide, please. So in terms of provider and meal or food package oversight, as with all of the community support services, DHCS emphasizes that providing a high quality and safe food intervention is important for Medi-Cal members. The updated service definition provides managed care plans with guidance on key responsibilities for oversight among current and prospective providers, such as reviewing staffing qualifications, food preparation, licensure, and safety, and nutritional information for meal interventions. So that wraps it for medically tailored meals. We will now transition over to asthma remediation. We can go to the next slide. And one more, please. Thank you. So what are asthma remediation services? So asthma remediation is designed to reduce acute asthma episodes that members experience through supplies like mattress and dust covers and home modifications like ventilation improvements or mold removal. The utilization of asthma remediation remains relatively low across California. In Q3 of 2024, last year, approximately 600 members utilized this support. And we do encourage key partners serving individuals experiencing asthma, such as primary care, EDs, or emergency departments, schools, and community organizations to build their understanding of and refer members to Medi-Cal services that can identify and ultimately implement solutions that can reduce asthma or acute asthma episodes for Medi-Cal members. Another key Medi-Cal service that we'll be discussing in just a moment is the Medi-Cal Asthma Preventive Services Benefit, or APS benefit. And really, DHCS's vision is that these two services, being the asthma preventive services and asthma remediation, can be used together to address a member's acute asthma needs. Next slide, please. All right, so for the updates. So for those of you familiar with the previous asthma remediation service definition, the community support previously covered two additional components: in-home trigger assessments and asthma self-management education. DHCS is removing these two components, the assessment and education, that is, from the community supports because in 2022, DHCS launched an asthma preventive services benefit for all of our Medi-Cal members. The APS benefit covers the same two services as asthma remediation, and so to reduce duplication, DHCS is updating the community support so it does not duplicate asthma preventive services. Medi-Cal members can still access both the in-home trigger assessment and asthma education through the APS benefit. So all services remain available and whole to the member or members. Next slide, please. So the updates deduplicate with the asthma preventive services as benefit, as I mentioned. Here we're just visually depicting the change that will go into effect on January 1st, 2026 for asthma remediation. So on the left side of the screen here, you can see that all three service components were available via the community support. And in the red box outlined here on this slide, effective January 1, 2026, asthma remediation will focus on the physical home and modification and supplies as a wraparound for the APS benefits. So members will first be referred to receive an in-home trigger assessment via the APS benefit, and then the results of the trigger assessment will be used as documentation to authorize physical home modifications and supplies under the asthma remediation community support. So finally, just wanting to note that the January 1st, 2026 go live is 6 months after the broader go live for the other community support changes to allow for providers of the asthma remediation community support to prepare to deliver services under the asthma preventive services benefit. Next slide, please. So really, to summarize, in-home trigger assessments and self-management education will be phased out of the community support and be available via the asthma preventive services benefit. One key change to highlight for providers and managed care plans is related to the authorization of the community support. So moving forward, managed care plans only need to document that an in-home trigger assessment was completed with recommended interventions in the last 12 months under the asthma preventive services benefit. So no additional provider recommendation will be needed for the community support. And then while these changes must go into effect January 1st, 2026, DHCS does encourage providers and managed care plans to start the process of shifting coverage for asthma education and assessment under the Asthma Preventive Services benefit as early as possible. Next slide, please. So for the community support February 2025 updates, just wanting to note that we at DHCS provided some additional resources and clarifications to the home modifications and supplies that will continue to be covered under the community support, including air filters supplied. Air filters supplied cannot be electronic or electronic air filters. Also, additional resources on integrated pest management services, and clarification that asthma remediation services and modifications can be delivered over time and do not have to be delivered at the same point in time up to the lifetime maximum of $7,500. So as I wrap up my overview of medically tailored meals and medically supportive foods and the asthma remediation, we do ask that you please continue to help DHCS spread the word on both of these critical community supports and the latest revisions that have been highlighted today. And with that, I'll now hand it back over to Susan to walk through the 3 additional community supports. Susan, over to you.
Great, thanks, Michael. Okay, before I launch into the next set of service definitions, we can move to the next slide. I wanted to call your attention to the fact that we actually renamed 2 of the community supports. The first community support, these are both related to nursing facility transitions. So the first community support was called Nursing Facility Transitions / Diversion to Assisted Living Facilities, such as residential care facilities for the elderly and adult residential facilities. So it's a big name. So we are now calling that a community support assisted living facility transitions. The second and related community supports we have renamed is what was formerly called Community Transition Services / Nursing Facility Transitions to a Home. So we are now calling that Community or Home Transition Services. So two renaming of community supports, and we made these name changes for a couple of reasons. First, we wanted to simplify the name since some of them were a bit long and unwieldy. But more importantly, we had received feedback from the field that using the term nursing home in the title of these community supports was associated with some stigma, especially for people who really wanted to be in a community or home. And it could potentially discourage people from using this service. And then it just led to some basic misunderstanding of what those community supports were really intended to provide. So hence the name change. Okay, so both of these community supports are really aimed at reducing nursing facility stays when appropriate and safely supporting members residing in community settings. So first, I'll cover assisted living facility transitions. The ALF community, we can move to the next slide. The ALF transition community supports, again, aims to support members who would otherwise need nursing facility level of care, and it helps them transition to and reside in an assisted living facility. So there are 2 service components of this community support. First, there's time-limited transition services to support a member in securing a placement in an assisted living facility. And then second, there are ongoing services. So once a member is in the assisted living facility, there's ongoing assisted living services, such as support with ADLs or activities of daily living, meal preparation, et cetera. So time-limited transition services as well as ongoing assisted living services. We can move to the next slide. So as I mentioned, at the top of the webinar, assisted living facility transition is one of the least utilized community supports. So because of that, we really prioritize refining the service definitions. And that was really aimed to more clearly define eligibility criteria and standardize and clarify those 2 service components. We also took the opportunity to clarify when and how members can receive the community supports when they are eligible for or receiving other Medi-Cal home and community-based waiver services. So really clarifying when a member can receive community supports if they're eligible or if they're receiving Medi-Cal home and community-based waiver services. We can move to the next slide. Okay, so again, to really promote appropriate use of the support, this community support by eligible members to divert nursing facility stays, DHCS is clarifying that members can receive the support, number one, if they are transitioning from a nursing facility to an assisted living facility. Secondly, if they're living in the community and are transitioning to assisted living facility, or if they're currently residing in an assisted living facility and meet nursing facility level of care. So the service definition has really been updated to emphasize that members in all three of these scenarios are eligible to receive the community support. Regarding the service components, we received some feedback from the field that DHCS needed to emphasize that managed care plans must really offer both components of the service. So the time-limited transition services and the ongoing assisted living services. One note here is that the ongoing assisted living services are available without limit as long as a member resides in the assisted living facility and continues to meet nursing facility level of care criteria. Finally, we provide additional guidance on whether members can receive additional community support services in parallel to, and to emphasize that while members may be eligible for both assisted living facility transition, community supports, and assisted living waivers. So basically, if a member is receiving assisted living transition community supports, they cannot receive both assisted living waiver services, for example, at the same time they're receiving assisted living transition community supports. This is really to avoid duplication of services. Under Medi-Cal, that can't be duplication of service. So if a member is receiving service, again, under the assisted living waiver, for example, they cannot also receive the same services under this community support. Okay, we can move to the next slide. Okay, so switching gears to community or home transition community supports, we can move to the next slide. This is similar to the assisted living facility transition support that we just discussed, but instead the aim of this support is to assist members in transitioning from a nursing facility back to the community instead of to an assisted living facility. So the service has two components. First, transitional coordination services. So that is really intended to support the member in identifying and establishing housing, as they're leaving the nursing facility. The second component is funding for a one-time setup expenses to establish a household, such as security deposit, utility setup, or cleaning fees. We also really want to emphasize that that we're talking about transition into a private residence, which could also include public housing. Okay, we can move to the next slide. And in response to quite a bit of stakeholder feedback we received, we are also releasing revisions to clarify service components and the lifetime maximum dollar amounts for one-time setup expenses. So that is a clarification that's included in the guide. We're also clarifying intersections in receiving this service with other community supports as well as waiver services. So as I noted earlier, we really want to make these clarifications so that the field understands, which members are eligible and can really drive utilization for members that are eligible, and so they can have access to and use these services as appropriate. We can move to the next slide. Okay. So in the service definition, DHCS clarifies specific actions that can be taken to support members with time-limited transition services and provides some detailed examples of one-time or non-recurring setup expenses. We've clarified provision of this community supports for one-time expenses, including when housing deposits might be used or when DME coverage is appropriate. So those are some nuances that we've clarified in the guide. We also explicitly outlined that the maximum for the non-recurring setup expense is $7,500 per member. So that is also a clarification that is outlined in the updated guide. Similar to the previous community supports, members may be eligible for waiver programs, but they cannot be a recipient of waiver programs at the same time that they are receiving these community supports. Again, there can't be a duplication of service. So for example, if a member is enrolled in California Community Transition Services or CCT, they can't also be receiving services under this community support at the same time, as that would constitute duplication of services. Okay, we can move to the next slide. Okay, so the last set of service definitions is related to personal care and homemaker services. So this support is really designed to allow individuals to safely reside in their home with assistance on activities of daily living or ADLs, or instrumental activities of daily living or IADLs. And services rendered here are similar to services provided through the In-Home Supportive Services Program, IHSS. So they're similar in terms of services that are available. So this slide outlines some examples of key services under the support, such as meal preparation, support for bathing or transferring, and support in getting to medical appointments, for example. So the guide really provides some additional examples of what really falls into the bucket of personal care and homemaker services. We can move to the next slide. So we really received feedback from providers and partners that there needs to be additional clarity on how this community support can be used in conjunction with IHSS services, as well as HCBA waiver services, which does cover similar services for a subset of members. So those are a couple of things that we want to clarify to really ensure there's clarity in the market and to really support utilization and take-up of this community support. We can move to the next slide. So first, we wanted to emphasize that IHSS really must be the primary source of support for members who are otherwise eligible for personal care and homemaker services. But members can receive this community supports during the IHSS application process, and it can also be provided in addition to IHSS hours when additional support is required for the member. So it can be used as a bridge as well as additive services to approved IHSS hours, but it is not intended to supplant IHSS services. Finally, members can also receive personal care and homemaker services when they're ineligible for IHSS, and that can happen in cases when the managed care plan provider determines that it is medically appropriate to prevent short-term nursing facility stay. And like the previous community supports that we discussed, members can receive personal care and homemaker services while they're on the waiver waitlist. So they can receive services again as a bridge, but they cannot receive it while they're also when they are actually enrolled in the waiver. So for example, if a member is receiving waiver personal care services provided through the Home and Community-Based Waiver Program in California, they can't also then be receiving personal care and homemaker services under this community support, really to avoid duplication. Okay, so that was a lot of material, and now we are going to be opening it up for questions and answers. We walked through an overview, as I mentioned, of 5 community supports that have been updated in Volume 1. So we are going to be addressing some questions that have come in through the questions and answers. So I will open it up now. Okay. So first question we have is, are these service definitions that were updated in February, or are there changes since then? So there are updates that were discussed today that are the same that were released in February 2025. However, there were some additional updates. For example, with nursing facility transition services, we made some additional clarification, and there's some additional tweaks, if you will, for medically tailored meals that were in the finalized version. So We did provide updates back in February 2025, and then we're also finalized, also based on input, comments, et cetera, from the field that we have now finalized in April 2025. Okay, so the next question is regarding the referral process for medically tailored meals or other community supports. So I will take this one. So in terms of referrals, providers and community-based organizations can make referrals for community supports to the members' managed care plan. Ultimately, there's a no wrong door approach, if you will, for referrals. The managed care plan is then responsible for reviewing eligibility and assess whether the member is authorized for the service, and then assign the member to the applicable community supports provider. So that is really how we envision the closed loop referral process to go. Members are also required to, the plans are required to have member and provider facing information. So, plans are required to communicate back to the member on whether they have been successfully referred, who they're assigned to, and the providers are also to receive information in terms of the requested authorization. So that information is part of the closed loop referral process. So in terms of also how organizations can ask for a referral or start the referral process for community supports, the member services line for a managed care plan is one specific way in which a community support provider can contact the plan. So there should be ways in which if a community support provider is contracted with a managed care plan, there should be very clear processes that the plan and their network provider, their community support provider, has already established on how referrals are to be made. Okay, next question. Michael, do you want to take the next question on medically tailored meals?
Yeah, definitely, Susan. Thank you. So the question I'm seeing is, for medically tailored meals, is the plan to identify best practices to determine what conditions are nutrition sensitive? Also, can we add additional guardrails, such as requiring a discharge from the hospital to justify chronic or serious conditions? So the updates to medically tailored meals do focus eligibility only on if the member has an eligible nutrition sensitive chronic and serious condition that would be appropriate for a medically tailored or medically supported nutrition service. So it no longer includes at risk for hospitalization or recent discharge from hospital or skilled nursing facility as an eligibility criteria. And it's also worth noting plans cannot impose additional criteria on top of an eligible nutrition sensitive condition. So plans can't require that the individual also be discharged from the hospital. Also, just wanting to highlight, if an individual meets a community supports eligibility criteria listed in the policy guide, the services are considered medically appropriate and cost effective. And plans are responsible for establishing their utilization management processes and standards to ensure that all referred individuals are medically appropriate for the authorized service. Hope that answers it. And Susan, if you don't mind, I do see another question on medically tailored meals, so I'll also go ahead and take a swing at that one.
Sure.
So seeing the question as, can plans standardize the criteria for defining the conditions that qualify for eligibility for medically tailored meals? For instance, what BMI would be considered obese? The medical criterion is a BMI of 30 or higher. However, requests have been received with a BMI of 27 and a diagnosis of obesity. So for that one, we would just note that plans may establish reasonable clinical thresholds for eligibility for specific nutrition sensitive conditions. For example, diabetes with A1C over 6.5 as part of their utilization management review for authorization. Hope that answers it.
Okay, great. Thanks, Michael. I see another question coming in. This one is related to asthma. So the question is, what education can DHCS provide to asthma providers? It seems that they are unaware of DHCS's APS program and their process for becoming certified with DHCS as an APS provider. So that is a great question. So as we discussed, these updates to the community supports policy guide as it pertains to asthma remediation community supports will be effective January 1, 2026. And we do, at that point, we provided that additional ramp up so that asthma remediation providers can enroll in the Medi-Cal program to then continue providing those components that Michael talked about, right? The in-home trigger assessment, as well as the asthma self-management education under the APS benefit. So we did provide a ramp-up phase for that. It is a great question about really providing information back to providers. That is something we are working internally along with our provider enrollment division, providing information through what's called our PAVE portal. So it's a state portal by which we communicate to enroll providers, but this is something we're also going to be working with our managed care plans to make sure they're communicating this to partners currently. So for example, if a managed care plan is a network of asthma remediation community support providers, we definitely want to make sure we're getting the word out there to the plans to work with their network providers to ensure that they are in fact enrolled through the Medi-Cal program so that they can actually provide the APS service. So great question. I think there is, we really are looking for many different ways to amplify this message because it is something that we do need our provider partners to understand and kind of go through their process. So please help us get the word out as well. And we will also be doing the same on our end. Okay, so Michael, do you want to take the next question?
Sure, happy to. So seeing the question in the last policy guide under asthma, a request was to have landlord consent for any permanent modifications. Has that request gone away? So before the commencement of a permanent physical adaptation to the home or installation of equipment in the home, such as an installation of an exhaust fan or replacement of moldy drywall, the managed care plan must provide the owner and member with written documentation that the modifications are permanent and that the state is not responsible for maintenance or repair of any modification, nor for removal of any modification if the member ceases to reside at that residence. And just wanting to highlight that particular detail of information is posted in our community supports policy guide on page 46 of the policy guide.
Okay, so the next question pertains to the assisted living facility transitions community support. It seems like there was a question specifically on the ongoing stay at the assisted living facility. So just to clarify, so the assisted living facility transitions has two components. First is the transition component, and then there's also the ongoing stay component. So managed care plans are required to really provide both of those components. That includes the ongoing assisted living services, as well as the transition services under the assisted living facility transition community support. So the goal is really to offer both service components to the extent that they're appropriate for the member, you know, as long as they continue to meet the nursing facility level of care need. So that is really the goal of the service. And this is how we've clarified that now that that community support really has those two components that have to be covered. Okay, well, we are at the top of the hour. I think we have I really appreciate everybody's questions and everything that came in. We will, as mentioned earlier, be making sure this webinar is, the recording is available, the slides will be available. We will be, if you have additional questions, feel free to email those into us through through our email addresses that we have available on our DHCS website. So I just really want to thank you all for joining us today for the webinar. And some of you also joined for Volume 2 on Wednesdays. So spent quite a lot of time with us today and this week, really. So we really appreciate the time you spent in understanding these additional updates. Obviously, again, just to reiterate, I appreciate all your input and us getting to where we are today. And again, there's efforts that's going to be needed in the next few months to really operationalize these changes as they go live July 1st of this year. Please do help us by distributing the policy guide and making sure that partners and others really understand the information to the extent that they would benefit from the information. We really want to provide opportunity to make sure that everyone knows these updates that are so critical for driving improved delivery and utilization of these services. So we look forward to working with you and hearing from you on how to continue to strengthen our community supports program. And again, thank you all so much for joining today. Have a great rest of your day. Thank you.